Hello and welcome to episode 5 of season 1 of Race in Society, where we're focusing on race and COVID-19. My name is Salika Zavalos. My co-host Alana Lenton is behind the scenes this week. We broadcast on YouTube every 2 weeks, so please make sure to subscribe so that you get notifications for our upcoming videos. So this week we're looking at intersectionality and the virus. But before we begin, I acknowledge that I live on the lands of the Wangal people of the Eora Nation and that I work on the lands of the Gadigal people of the Eora Nation. Colonisation has imposed social structures that are set up to oppress Aboriginal and Torres Strait Islander people across every social institution, from racial and gender discrimination to health to the economy and beyond. And yet Aboriginal people's knowledge, their cultural systems and their ancestral ties are ancient and unbroken. While the nation of Australia was founded to enforce divisions and inequality, Aboriginal and Torres Strait Islander people remain connected to their country and to their communities. Sovereignty was never ceded and remains never to be extinguished. On to today's topic. American legal professor Kimberlé Crenshaw is one of the original theorists of intersectionality. She used this term as a way to show that Black women in the USA experience multiple inequalities. Writing in 1989, Professor Crenshaw showed that industrial law treated racial and sexual discrimination as distinct experiences. She showed that Black women experience both racism and sexism simultaneously, and so the impact of each is compounded. Professor Patricia Hill Collins and other theorists have also shown that without using this term specifically, people in the Global South have used intersectionality as an analytical tool since at least the 1800s to grapple with the complexity of discrimination. In Australia, we look to the works of Professor Aileen Moreton-Robinson, such as in her book, Talking Up to the White Woman, which examines how white feminist research has established authority by mobilising whiteness and enacting power over Aboriginal women. Intersectionality is not an identity, but rather a way to understand power relations in society, as well as social inequality, by looking at the interconnections of social division, including race, gender, disability, sexuality, and class. Our panel today will examine the intersections of race, gender, and socioeconomics which impact the work by Aboriginal healthcare workers. We'll also look at how social norms of whiteness and anti-Blackness are playing out in the pandemic. And we'll also look at how intersectionality can help shine a light on gender and sexual violence under social isolation. So first we go to our guest, Carl Briscoe. You're the Chief Executive Officer of the National Aboriginal and Torres Strait Islander Health Worker Association, or NATSAWA. Your organisation has been proactive in producing resources throughout the pandemic, from advice to Black Lives Matter protesters, as well as the Aboriginal and Torres Strait Islander Health Professionals Resource Toolkit. What are the racial, gender and socioeconomic intersections of NATSAWA? You're focusing on the support of Aboriginal health practitioners. So how are you doing this work, which is helping to prevent the spread of COVID-19?
Okay. Thank you, Zalika. Before I get started, I would like to start by acknowledging the traditional lands of the Ngunnawal Ngambri people, where I'm streaming from today. I recognise the many rivers, mountains and seas and landscapes and the wind that blows over these ancestral lands, which remain under our continual custodianship. I'd like to pay my respects to elders past, present, and to our future elders yet to come, and to my Aboriginal and Torres Strait Islander brothers and sisters who may be online today. Yes, that's correct. My name's Carl Briscoe. I'm a Gugayalanji man from the Mossman Daintree area in far north Queensland, Australia. As the CEO of the National Aboriginal and Torres Strait Islander Health Worker Association, or NATSIWA, I'll aim to highlight how some of the concepts and frameworks explored through the Race and Society series are being considered and incorporated into the design and delivery of policies, programs, services in the healthcare system. Today's episode's all about intersectionality and the virus. For me, the way Aboriginal and Torres Strait Islander people have managed to mitigate the risks associated with COVID-19 provides a great example of how the concept of intersectionality is instinctively applied by Aboriginal and Torres Strait Islander led and managed organisations working across the healthcare system. And in this respect, it also reinforces the values and strengths of our organisation. So NATSIWA is one of 4 national peak workforce bodies working to ensure Australia's healthcare system meets the needs of Aboriginal and Torres Strait Islander people. We are essentially funded by the Australian government to promote the prevention and control of diseases and other health conditions in Aboriginal and Torres Strait Islander communities. Important, improve the health outcomes of Aboriginal and Torres Strait Islander people. Also, to address the impacts of Aboriginal and Torres Strait Islander disadvantage and address the underrepresentation of Aboriginal and Torres Strait Islander people working within Australia's healthcare system. While each organisation holds responsibility for a different profession within their workforce, we all work together to promote the prevention and control of diseases through a focus on the social and cultural determinants of health in policy and program design. This holistic approach provides a foundation for understanding how the intersection and divergent impacts of ongoing social disadvantage, systemic racism, discrimination and trauma have had and continues to have a real damaging impact on the health and well-being of Aboriginal and Torres Strait Islander people. At the outset of COVID-19 pandemic, it also positioned us as the best place to respond. Prior to COVID-19 reaching our shores, we knew that our communities were vulnerable and at risk of serious infection and mortality. Together, through our combined lived experiences, we understood that Aboriginal and Torres Strait Islander people have a high prevalence of comorbidities, which puts them at higher risk of severe COVID-19 illnesses. 1/4 of Aboriginal and Torres Strait Islander populations live in remote areas. This makes access to health services difficult. Many health services, particularly in remote areas, are ill-equipped to handle a surge in demand. The Aboriginal and Torres Strait Islander population is highly mobile, with people frequently travelling between communities over long distances, making them highly vulnerable to the spread of diseases. The high proportion of Aboriginal and Torres Strait Islander people who live in overcrowded homes makes isolation difficult. Communication needed to be tailored to meet the needs of our diverse cultures and communities, and mainstream approaches are ineffective in dealing with the diverse cultures, circumstances, and barriers inherent in our communities. From the very start of the pandemic, the Aboriginal and Torres Strait Islander health sector worked to mitigate risk of exercising our leadership and working collaboratively to develop responses, mobilise our networks and harness support. At the national level, Aboriginal and Torres Strait Islander health representatives partnered with government to develop culturally informed strategies, while leaders at local levels coordinated action and engaged communities. Within NATSIWA, we understood that our workforce needed to be equipped with tailored support. In this respect, we worked with our Aboriginal and Torres Strait Islander workforce peak organisations to produce a toolkit and deliver webinars specifically targeting the needs of our Aboriginal and Torres Strait Islander health professionals. We recognised that in caring for our communities, our workforce often carried additional burdens and therefore the need to practice ongoing self-care. We held yarning circles with our national network of Aboriginal and Torres Strait Islander health workers and health practitioners, so we could alleviate issues specifically impacting on them if required. We distributed regular COVID-19 updates, providing advice on infection control, the prevalence of outbreaks, and the quick access to trusted sources of information, and we sought to ensure the diverse needs of both the workforce and Aboriginal and Torres Strait Islander people were considered as part of our ongoing national response. Our work represents just some of the much larger coordinated responses by Aboriginal and Torres Strait Islander health sectors, highlighting how the small connected actions of each of us working together can make a large difference. So far, we've managed to keep our vulnerable communities safe, reinforcing that health and well-being of our people is contingent upon policies and programs being designed and informed by our voices, our choices, and our cultures. Going forward, key challenges will be ensuring equitable and timely access to a vaccine when and if it becomes available. And in the midst of the pandemic, we must also continue to work to ensure that our health services are culturally safe and people, regardless of their age, gender, and race, are able to exercise the right to health and well-being. The pandemic isn't over. There are clearly more challenges ahead. What will be required is an approach that ensures no one is left behind. This means continuing to work to inform ourselves and the health system about how we can respond to the complex and interrelated needs of our diverse communities. Thank you.
Thanks so much, Carl. That was amazing. And as I hear you speak, I'm reflecting on the fact that your organisation is obviously leading in this space. I know that your organisation acted a lot quicker than the federal government's response. And so I guess I'm thinking about the fact that your success of your organisation is also an indictment of the failure of mainstream services to be providing that timely support. And you've also identified the need for having that lived experience of race and culture to respond quickly to public health emergencies. Thank you so much. Next, let's go to Professor Karen Farquharson. Karen, you've studied race in Australia, South Africa, and the United States, and you've looked at how ideas of whiteness are used to dehumanize Black people. Reflecting on your work on racial and disabled minorities, can you describe what is meant by norms of European whiteness and anti-Blackness, and how this might be contributing to inequalities emerging from COVID-19? How can intersectionality help us to address these dynamics?
Thanks, Zalika, and thanks, Carl. That was really, really interesting, and your organization is doing some really impressive work. Before I start, I'd like to acknowledge that I live and work on the land of the Wurundjeri and the Kulin Nation, and I note that the land is unceded, and I pay my respects to elders past, present, and emerging. I pay my respects to Carl, and I pay my respects to any Aboriginal and Torres Strait Islander people in the audience today. So in my research, I tend to broadly come from a critical race theory perspective. Critical race theory comes out of critical legal studies, which is where Kimberlé Crenshaw is sort of situated. And it proposes that racism is normal everyday practice. And it proposes that our social institutions, and social institutions are things like government, the education system, race is a social institution, are structured so that in white-dominated societies like Australia, white people will be in control of decision-making and in control of the majority of resources. And in order for non-whites to access resources, whites have to consent. In critical race theory, anti-racism will only come about when there is interest convergence. And what that means is the interests of the white majority has to be in their interest for the anti-racist action to happen. Otherwise, it won't. They'll resist it, and any kinds of attempts will be symbolic, not actually having any real change. So when we discuss norms of European whiteness, what we're discussing is the dominant understandings of how society works in white-dominated societies. So the norms of European whiteness are the norms around who should be in decision-making roles, where people should live, how people should be in public, and these were all racialized in such ways as to prioritize people classified as white and deprioritize people not classified as white. Norms of European whiteness are connected to anti-Blackness. Anti-Blackness is racism specifically against Black peoples, and it includes dehumanization, so the situating of Black people as less than human, and therefore justifying the treatment of them as less than human, and any kind of differential treatment against Black people as it has a negative effect on their lives. I'll just give an example. So for example, a group of medical students go into a patient's room, and each of the students wants to examine the patients. The patient agrees for all the students to examine them, except when it comes to the Black student, and then they withhold their consent. Or another example, a Black person gets into Harvard and people don't believe it was on merit. They believe the person got in under some sort of special deal. White privilege is the unearned privilege that comes from being considered white, and white privilege means that people who are considered white get advantages in life. Anti-Blackness means that not only do Black people not get that privilege, they actually get material disadvantages from being Black. And COVID-19 brings these inequalities to the fore. So while infectious rates for the disease are high across the board, in the US and in the UK, Black people are far more likely to die from COVID-19 than any other group. In the US, they're twice as likely to die from COVID-19 as white people are. So for infected people, Black people are twice as likely to die. Other groups such as Latinx people are also more likely to die than white people, but not so much more than Black people. We don't have those numbers for Australia because we don't really track race here. So we don't know if Black people are more likely to die. And in fact, because of organizations like Carl's group, we've had much lower rates of infection than we might think of for Aboriginal communities because they've been taking care of business. And they know that they're at higher risk because of their intersectional positioning and the fact that they have more higher cases of things like diabetes, which make COVID much worse. So why are Black people more likely to die? And the answer is racism. Black people are more likely to be poor. They're more likely to have higher incidences of chronic illness, and these things make COVID-19 worse. They're more likely to live in crowded conditions and experience racism when trying to access healthcare. And an American sociologist named Tracy McMillan Cottom has written an excellent book called Thick. And in that book, she recounts her experience as a very well-educated African-American pregnant woman trying to get care for her pregnancy, and actually not even, despite all of her cultural capital, her cultural advantages, her education, still not be able to access that care. And it's a tragic account. Black people are also more likely to be in precarious work without the ability to call in sick without losing wages. So if you need the money and you have to work, you don't have as many choices and you're more likely to go to work sick and therefore more likely to spread COVID, but also more likely to catch COVID. As I said, it's hard to say what the differential impacts are in Australia because apart from whether a person is Aboriginal or Torres Strait Islander, we do not collect racial data. And even that racial data is patchy. We do know that Asian appearing people have been experiencing public racism since the advent of COVID. But it's unclear about other groups because we really don't have any data on that. Intersectionality means that people have different experiences when they come from a different combination of social categories. And I think intersectionality is a useful concept to highlight that different people will have different outcomes in terms of COVID. And analyzing COVID-19 through an intersectional lens enables us to consider, for example, that women working in aged care who are often not white might have a different experience than white men working in a university. They may be in insecure employment. They might have to work in multiple facilities rather than a single job. They likely can't perform their work at home. I'd say intersectionality doesn't provide answers, though. It actually points out questions that should be asked and things that should be attended to, of which there are many. And I also will just note that we have quite a lot of international students here and people on tied visas that are tied to their workplaces. And for them, they don't really have the option to not work because they're not eligible for government assistance. They can't get JobKeeper and Job Seeker. And so they're in a real bind and at real risk for COVID-19. And I'll stop there.
Thanks very much, Karen. Thanks for your reflections. I'm struck by the way you're talking about the fact that we actually cannot compare experiences that we intuitively would understand from the literature about the impact of race in the same way than other places like America, because we're not collecting that data. And it's an interesting thing for our viewers to note that it was a decision of the white Australian majority, the people in power, to really shift discourses in Australia away from race in the 1970s, as we moved from a policy of assimilationism, which had a very coercive and oppressive impact on Aboriginal and Torres Strait Islander people, as well as on migrants who were considered to be not white. And then we shifted to where we are now, which is we don't talk about race, but we do talk about ethnicity. And so there is a gap in our understanding, and it's a problem in many ways, but especially during a pandemic when we know that race is having an impact on how the pandemic is being managed, but we don't have the right data to really make informed decisions, and in particular to provide funding and policy support to organisations like NATSAWA, who are doing that vital work. Thank you so much. So now we're going to move to a question for Dr. Nilmini Fernando, who is a postdoctoral research fellow at Griffith University and a scholar of Black and post-colonial feminisms. Nilmini, your analysis of domestic violence, you've seen that the research that's been produced at the moment on patterns of domestic and family violence during the pandemic have varied. So there are some states in Australia that are recording a no rise in the number of serious physical assaults, and there are other states that are recording high increase of cases. Your work shows that in the field of domestic and family violence, there are analyses which are supposedly using intersectionality, but they actually have a low awareness of race. Can you tell us what impact does this have on our responses to COVID-19?
Yes, I would just like to acknowledge that I'm speaking from the unceded lands of the Wurundjeri people of the Kulin Nation in so-called Naarm, Melbourne. I would like to pay my respects to Carl and any Indigenous people in the audience. I would just, basically, I would like to just start by saying I'm not a person who is data bound, right? And I think in the domestic and family violence sector, there are two things that really stick out to me. One of them is the way that violence is measured, categorized. It's all to do with categories. So the categorical, divisive, fragmenting, finding more and more and more and more difference about how violence is perpetrated and the definition of violence itself. It's lifted out of the coloniality of gender, of race, and of class and capital. So I'm in there. I'm a kind of a lone soul in that sector, but it's a very fruitful place to work because, as I'm hearing, that's where a lot of the harm happens, right, as people are trying to help. So I think that's a neglected sector in terms of knowledge and education. People don't have the terms and concepts to be able to understand this. The focus on physical violence removes the coercive control, and it removes us talking about state-facilitated physical violences. And so you push a person to leave. I'll talk about women because they're the main, but push a person to leave. Once they leave, they face, my research in financial abuse showed that they just then have to navigate like 25 different agencies just to survive. And each of those agencies is the possibility of race, gendered, class-based harms. Second of all, the reliance on the criminal justice system as a solution, where the policing has gone up in COVID. People of colour, for all the reasons that Karen's talked about and Carl's talked about, that they don't rely on the criminal justice system because it doesn't serve them. It actually victimizes and targets them. And and harms them very violently to the point of death, as we have seen in the deaths in custody. So my critique is actually at the place where Aileen Moreton-Robinson really points out theorizing just for white feminist bureaucrats, corporatized, not-for-profit sector who are leading the discourse, framing it, talking about it, and just sucking up probably all the knowledge of the organizations that have worked with this model for the last 30, 40 years and made really beautiful, nuanced knowledge, which is just being mainstream. So that's what's going on at the moment. And so I'm very much at that, and I'm really glad to have seen it, how it plays out, because we understand a lot of the colonial structures, but not really see how that flows through to the disciplinary level, to the and to the practice level, managerial policy, all those things, how it actually happens, and how we each located at each of those levels, macro, meso, micro levels, can embody whiteness and embody the state thing, even if we're not people of color, even if we are people of color. So it's anybody can do that harm if they are indoctrinated through this discourse. So that's the kind of, so my approach then is to use Patricia Hill Collins' theory. So she feels that intersectionality as on an individual basis is based on what we all think it is. However, I then go a step further and map within each context, within each practice situation, whether I'm working with managers or organizations, what's going on in terms of what powers, what disciplinary powers, what cultural powers, what structural powers impede. So I put the person that we're exploring in the middle and look out to all the barriers that are actually obstructing their agency. So doing intersectionality badly, which I find it inadequately, is the additive categorical model, which never looks at power. It's power evasive, therefore it's race evasive, state evasive. We can't speak in that discourse. So the separation of all categories and more categories means that the deficit discourse is reinscribed on the people that are different. So people get different and more groups of different, but we're not all getting together. It affects solidarity because we can't actually see the powers that are in common making oppressive conditions for us to live in. So race, as Karen has said, is just completely invisible. It's masked under culture and ethnicity. There are no anti-capitalist critiques going on. So feminists of color are very strong on anti-capitalist critiques. So especially in the field of financial abuse, we need to really understand that it's the reason why women can't leave. It's the reason why they go back to violent relationships. So, and any of the ideas about financial capability that we're throwing out, I'm very careful to disrupt that whole idea that we can actually improve that by improving the person's skills. It's got to be changing the structures. But what actually happens when you do the categorical, data-driven, fragmenting approach, which rules, and the white female middle class that rules the service space, social work, family violence, is that they don't know how. They mention power, but they don't know how to deal with it. So there is no kind of political activism going on. There's no political or intellectual activism. And that's because the theory is, it also excludes the people who are doing this work. So we can't be in those spaces of power at the table, speaking and shaping and directing the discourse. So that's what I'm finding happening. And so in my work, so I do research, but also I work with practitioners. Now here we have a completely different kind of, most are so willing to, they want to change, they know they want to change, they're on board with the change, but they are not, haven't got the language. So I think very much intersectionality is a form of literacy that I try to provide, concepts, language, and even in their university courses, they're not trained in these. And actually I think they should be, but also sometimes you don't really know how to use this until you're in practice. So I really vie for practice-based scholarship because you're right there and you can see what's happening and you can actually influence your organization, which I have done, I hope. Being a feminist killjoy, I've been a pain and I've just pushed and pushed. And now, you know, it is changing a little bit. So I work with, so I just would give them sort of concepts, tools like, you know, how identify, what powers force identities, and then what happens to those identities, what powers make some differences more important than others, and then how those differences matter within and between groups who are marginalized. And I'm not understanding about what power is. People don't really understand or know how to talk about power. And so in a way, I think that what we do is I ask, like Karen said, a lot more questions. What are you doing that might be sustaining these oppressions or working against other marginalized groups, competing for funding being a case in point. You know, what is my funding doing that's preventing somebody else from getting? We should fund. And in this fund, Aboriginal women, their services are separate. So even then, we don't get the opportunity as women of colour, all under the gaze of whiteness, to work in solidarity to push against those structures and dismantle them. So I think that that's kind of what I wanted to say. And I think that the important thing is understanding how power flows through and who enacts it, under what conditions, and how we might disrupt those conditions. And I think the practice, managerial, that kind case manager level is a very neglected area where we can do a lot of change. And so looking at the deep racialized, gendered segregation that exists between frontline workers and policymakers and bureaucrats, you know, and the idea that white women, as Aileen said, they sort of locate their position as variously classed, maybe disabled, but never raced. And it's an unwillingness and a partly an ignorance, but I think even Aileen says that when white women are not, they're very smart, you know, so it's kind of like, how are we going to make it an attractive proposition for them to divest their power, to understand how they too are being oppressed by the very same systems to a different level. So I'm just going to leave it there.
Thank you. Very, very interesting. One of the things that we're really trying to do with this series is to really bring race back to those power structures, to those institutional bases, as you say, because people in Australia don't really have an understanding of how race is embedded into social institutions. You know, you've talked about how effectively the system pushes survivors to go back to institutions that re-traumatize them, and in particular to the criminal justice system, which is especially punitive to racial minorities. And, you know, connecting what you said also with what Karen was talking about, white people need to give up some of that power. And if they don't see a need to give up the power, then it's very difficult. The struggle continues to be for racial minorities to make the case for things to change. And in a pandemic, people are really not thinking too much about, you know, we keep hearing from leaders, it's not the right time to think about those long-term changes, but the reason why we're having this pandemic in the first place with people who are racial minorities being facing extreme violence and also being precariously employed, it's all linked to those power structures that you've all talked about. So thank you so much for your reflections. I wanted to now end by asking each of you to just reflect on a question to bring our discussion back to the pandemic. So rather than separating racism, sexism, and other forms of discrimination, intersectionality is a theory that encourages us to think about the interconnections of race, gender, and other institutional forces. And that's really come through in what all of you have said today. To summarize our discussion, can you tell us about how you think intersectionality can be introduced into public discussions of COVID-19? So we'll start with Carl.
Okay, thank you, Salika. So as outlined earlier in my response, I consider the understanding of health and well-being through a focus on social and cultural determinants of health. It provides a foundation for understanding the concept of intersectionality. This holistic approach recognises the issues impacting upon the health and well-being of our people don't exist in isolation, and that in many cases of poor health are interrelated and often lie outside the direct responsibility of the health sector. The concept of intersectionality operates in pretty much the same way, serving to highlighting that multiple forms of inequality amplify and impact beyond the boundaries of any one sector, and it requires a collaborative, multifaceted solutions. There is opportunity, I think, to introduce intersectionality into the public discussion on COVID-19 by highlighting the need to recognise racism, discrimination, impacts on people in all different ways, supporting organisations and agencies to consider diversity in everything they do. For example, while you may consider your workplace to be racially and culturally diverse, is it accessible to people with disabilities? Does it support people of all ages, genders, and sexualities? And encouraging broad engagement to ensure future policies and programs are informed by and reflect the needs of the diversity inherent within our society. Ultimately, in responding to the impacts of the pandemic, nobody should be left behind. Thank you.
Thank you so much, Carl. Karen?
What he said. I think that's exactly right. I think the term intersectionality is a term that turns people off. I think they don't understand it, and they don't want to engage with it. And I've been using it for quite a few years now, and I mention it and people's eyes glaze over. I think people understand what it means, but I think that the concept is as a thing, it's not that easy to relate to. But I think people are very concerned about the differential effects of the pandemic on different types of people and different groups of people, people with a disability, people in aged care, people who are disadvantaged, and those things connect with race and racism, and people who are disadvantaged and people of color are more likely to be disadvantaged, and they're more likely to be in insecure employment, and they're more likely to be affected by the pandemic for those reasons. And I'm just thinking about, you know, when with the whole Victoria lockdown part 2 was happening, and the discourses were around the security guards, and the security guards were represented as careless racial minorities who didn't follow instructions properly, which is not the case. It is, you know, they were very concerned, but they were not given proper advice, and they were put into very, very difficult circumstances. I think this is what's coming out in the review now. They were put into very, very difficult circumstances that they didn't have the power to actually change in their positionality. That kind of discussion, you know, had they had the right resources, this whole second lockdown might not have been needed. So I think intersectionality is actually really important, but I'm not sure we should be calling it that because I just think people don't like the term.
Thank you, Karen. Nilmini?
Just like to say all that you said to Karen and Carl, because it's all flowing together. It's almost like it's just become a buzzword, and I feel that it's been undone, which is a critique that Sarah Mabilje gives us. It's been undone, and it's been done. It's been sort of adapted and added and stirred into whiteness. So there's a whole load of change that needs to happen, and I think I can see it a bit happening. Where there are two things going on here. One of them is when you pick up intersectionality without a feminist movement, or a feminist movement that is wide, there is no political organization that we can just pull it together and say, right, we're ready to act, which is what I saw happening in the housing estate. Those people were ready. Now, as I understand it, there are several hundred complaints sitting at the Ombudsman. That is the way we deal with this once people are ready and activated politically. So there are changes, and then suddenly I'm finding everybody's invited onto panels, but these panels are often mediated by white. You can't have an all black panel or an all women of color panel. And I think Aileen Moreton-Robinson again was on a very big panel in Sydney, and she was saying that the bio, even then they're made to look different and deficit and fetishized and vilified. Like her words used to describe her were sledgehammer. And, you know, her book Talking Up, they used the word sledgehammer, and that, you know, she's painted as an aggressive black woman, angry black woman. So that kind of representation is important. So more people are coming on the stage. But what I find happening is like people ornamentalize their panels with people of color. The same ones get chosen all the time, the safe ones, or the ones who maybe don't know who they're working with yet. So they say yes to a panel only to find themselves racialized within that while they're doing the panel. So that's important. So we can't be added and stirred. And also we need to kind of be a bit more, work in solidarity. And I guess, you know, the women's movement, I'm just thinking, where is it? You know, you can't have an activism without a movement. So I'm really reminded of Angela Davis's quote, that there is, I hope it's Angela, not Toni Morrison, but you can't expect governments who are always self-serving to do what only movements can do, mass movements can do. So activate the people, making sense of this, and using intersectionality in a way that doesn't put people off. And I think that, you know, giving more public education, speaking spaces, having people that can control the discourse and take it over is very, very important. And rather than thinking it's a theory that we have to apply, we need to be able to enact it. We need to, and that's what so going towards a praxis. Yeah.
Thank you so much. And thank you all for your reflections. I definitely see it's interesting, the reactions to intersectionality. It's the spectrum is either, as Karen said, it's overdone, people are sick and tired of it, they think it's a burden or something that they roll their eyes to, or as Nilmini is saying, it's something that is added on as an afterthought, window dressing maybe for a panel, or on collateral and marketing, but not necessarily practiced. And but we've also seen how NATSAWA is doing that practical work, and it's just part of the everyday work that Aboriginal and Torres Strait Islander health workers have to do. I think there's a bigger discussion here that I'd love for us to return to about how anti-racism theories, tools, methods become incorporated within the white mainstream to try and disempower the importance of the practice that lies behind these theories and these methods. But it's a bigger discussion than today. But I thank you all for your time. And I want to thank everybody who's watching at home. Please remember to like this video and to subscribe to our channel. And our conversation continues on COVID-19. Next time we're talking about policing the quarantine. We're featuring Cheryl Axelby, the co-chair of the National Aboriginal and Torres Strait Islander Legal Services and Change the Record. We'll also speak with Professor Megan Davis, who's Pro Vice-Chancellor Indigenous and Professor of Law at the University of New South Wales. And we'll also feature Dr. Vicky Sentis, who is a Senior Lecturer in Criminal Law at the University of New South Wales. So thank you all once again, and until next time, please take care.